According to the Centers for Disease Control and Prevention, evidence continues to grow showing that the COVID-19 vaccine is safe and effective for those eligible to get one, even for patients who are pregnant. Patients who are pregnant and test positive for COVID-19 are more likely to experience complications that not only can affect their own health, but their babies as well. That's why obstetrics and gynecology doctors like Carolina Sueldo with Community Health System are encouraging patients who are pregnant to get a COVID-19 vaccine. Contracting COVID-19 when pregnant can lead to serious complications.
What we found was that pregnant women were at significantly increased risk for COVID disease. So they had higher hospitalization rates. They had higher rates of admission to the intensive care unit. We saw increased risk for miscarriage, increased risk for preterm labor, preterm delivery.
Now with vaccines to help prevent COVID-19, healthcare providers are looking to educate patients who are pregnant on the importance of vaccination.
What patients need to understand, or what the public needs to understand, is a few things. So number one, mRNA vaccines have actually been around for a long time and they've been studied for a long time. The specific COVID mRNA vaccine is what was new, but the technology of mRNA vaccines is not new. Number two is that the two large studies, Pfizer and Moderna, actually had almost 100,000 patients between the two of them. So while it was, fast, it actually covered a huge amount of the population. And the idea was that there was a ton of funding and a ton of support to push this through faster, which is why they were able to acquire so many participants for their study in such a short amount of time. Number three, we know, and it's documented both at the bench research level as well as the clinical level, that mRNA vaccines break down rapidly. They do not alter a human's DNA. They do not pass the placenta. They do not alter the developing embryo. It's something that is recognized by our defenses, by our immune system, and then is immediately broken down. Number four is that now at this point, even though we haven't had the luxury of time, we do have the luxury of volume, with millions and millions of people across the world being vaccinated, and that speaks to the efficacy and the safety of that COVID vaccination.
Even through various trimesters and milestones like breastfeeding, the COVID-19 vaccine is deemed safe.
Ideally, we would love them vaccinated during pregnancy, because actually there are really good studies now showing that the defenses that baby comes out with at delivery are actually higher than if the baby were to get COVID infection and then develop their own antibodies. There's no restrictions to trimester. There's no restrictions to the timing of other vaccines. In the same way that other vaccines are recommended postpartum, like hepatitis B, like the flu shot, COVID vaccine would fall within that range, so no risk for breastfeeding. So it really is a discussion with the provider. It really is trying to educate yourself through vetted agencies like the American College of OBGYN, like the American Society of Reproductive Medicine. If you go to any of their websites, any of their social media, you will absolutely see recommendations for vaccination.